Case Western Reserve University School of Medicine in Cleveland, Ohio. This is the All Access Med School Admissions Podcast. Hello again, everybody. I'm your host, Christian Essman, and I'm the Senior Director of Admissions and Financial Aid at the School of Medicine. Great to be with you again. Couple updates for you I wanted to share before we get into the conversation today about GW's School of Medicine. They're updates out of the AAMC. One is they published their 2024 enrollment information. It's a big infographic, and I put a link to it in the show description, and it really breaks down what the services looked like last year and all the students that enrolled in medical school last year, all the data about that last admissions application cycle. So check it out. There's some really interesting, cool information in there. The other thing that's become available is that the AAMC's Fee Assistance Program applications are now open. And if you're not familiar with the Fee Assistance Program, it's designed to help applicants by reducing the financial burden of applying to medical school by supporting, those who might not otherwise be able to afford the MCAT, AMCAS applications, and some other essential costs. Of note, if students are awarded the Fee Assistance Program by the AAMC, most, if not all, medical schools will waive their secondary application fee because of that AAMC fee waiver. So that's something else to keep in mind. And something new for 2025 that they've added is that recipients of the fee waiver will also receive MCAT official prep materials every time they're approved. So instead of just once in their lifetime. So this change, their website says, offers more flexibility and continued access to the AAMC prep resources and, making it easier for students to prepare for the MCAT. And the last update to share with you is that the AAMC will be having their annual or spring virtual fair coming up on April 16th and 17th, 2025. On Wednesday, April 16th will be their live info sessions. Those go from 11 a.m. to 4 p.m. Eastern time. And there'll be admissions people on panels and stuff talking about various topics. And then on Thursday, April 17th, will be the opportunity for registrants to come and talk to med schools in their virtual booths. And it works. There's a chat feature, so you can type in your questions and have a dialogue back and forth via chat. And some schools have opted into using a Zoom feature, and which you can go into that school's Zoom room and then talk to representatives, just on Zoom. So not every school is doing the Zoom option, but some are. Case is. So somebody from Case will be in our Zoom room from time to time. So you can pop in there and say hello and ask your questions and do it that way. And the other thing I think is cool that they've added this year is that if you register and attend, you will get 15% off the MSAR subscription, so the Medical School Admissions Requirements Guide. So if you register and attend, you get 15% off, so save a few bucks on the MSAR. So I counted up, there's going to be over 50 medical schools doing the virtual fair, and from all over the country, so check it out. It's easy, it's free, and you can get a lot of great information in a short amount of time. So I encourage you to do that. Okay, let's switch gears here. Let's get into talking about the school that we're featuring today, and that is George Washington University's School of Medicine and Health Sciences, located in Washington, D.C. My guest is Yanis Katroulis. He is an MD. He has his PhD. He has his MBA. He's also the Associate Dean of the MD Admissions at George Washington, and he provides overall leadership in the medical school admissions and strategic direction and the priorities for the admissions program. Additionally, he is the co-director of the Clinical and Translational Research Scholarly Concentration for the MD program, which we talk about in our conversation. He's also an associate professor of pediatrics and emergency medicine and a practicing pediatric emergency medicine physician, and and an NIH-funded principal investigator. He does a lot. He has led many initiatives in medical school admissions, and he's a member of the AAMC's Technical Advisory Committee for the use of artificial intelligence in medical student and resident selection, which we touch on near the end of our conversation. He's also the recipient of several research and teaching awards. Dean Katroulas is a member of national committees on research and medical student education. The guy does it all. He is an expert. So I invite you to sit back, relax, and enjoy this conversation that I had with Dr. Katroulas. Thanks. Well, hello, Dr. Katroulas. Thanks so much for joining me today. It's great to have you here.
Thank you so much for having me. And please call me Giannis. It's very nice to be here, Christian.
Great. Thanks, Giannis. Well, listen, before we get right into talking about all things George Washington, I want to hear a little bit more about you. Like, how did you land in this role as the Dean of Admissions?
Well, that's a great question. So actually, I've been involved in admissions since 2013. So for quite some time, as an interviewer, as a committee member, and not only at GW but at my previous institution as well. And I was fascinated by the whole process. And of course, I wanted to be involved, even as a faculty member, in the process of selecting the best, applicants that would align with the mission of our medical school. And, I do have a passion for admissions. A lot of people don't realize how many things go into that, into the admissions process. It's not just, reviewing applications, an interview, and there's so much more that goes on. And of course, another important function of the role is communicating with the applicants, which I find very rewarding, and shaping the future healthcare workforce. So I've been in this role as a Dean of Admissions here at GW for the past 3 years. Again, I was a committee member before, an interviewer. I had reviewed files for many years, and now I'm honored, and I really love running the Office of Admissions here at GW.
What surprised you in your role?
So one thing that really surprised me was, I always knew that we had a high volume of applications, but it was not until I actually started working on this role that I realized what that means in terms of, the process itself and how many people work for that. In the Office of Admissions, the admissions committee, this is one of the most important committees in the medical school, and the amount of work that they have to do. And when people ask me to, faculty members, should I apply to be on that committee, I always explain to them what it means to be a committee member. But there is a lot that's going on. And again, having so many applications makes it challenging, but also, again, very rewarding because we get to select from a large pool of applicants.
Yeah, there's we talk about that at our school too. Our Dean of Admissions will say when people bring up about being member admissions committee is that it's a lot of work, but we always have positive, measurable outcomes, because it's very possible to work at a university and be on all kinds of committees, and it's sometimes there's always kicking the can down the road on something. But an admissions committee, there's always a beginning, there's always an end, and there's always a positive, measurable outcome at the end of every season. So it's not some of these committees that go on and on and on and on.
Absolutely. And, it's not just having discussions. There's actual work that happens behind the scenes for the review of all those applications and the decisions that are made. And applications are reviewed multiple times in a cycle. And just, so people know, most of those cycles are, at the time one cycle ends, we're about to start the next one. So it's like a never ending process, which is, again, as you said, it's it has multiple challenges, but it's also very rewarding.
Yeah. And you're a busy person. Being the dean of admissions, you're a pediatric emergency medicine physician, you're a primary, or you're a PI on some NIH funded grants. How do you find the balance in all this?
Um, that's a very good question. At times, I don't know whether I'm in med school or in the hospital or in my research lab. But, I have to tell you, I really love what I'm doing, and I do have a passion for academic medicine. I see all those roles as part of academics and of academic medicine. And they're very related. We're selecting, students that will then become physicians, principal investigators in research programs, and the future of medicine, right? Which it's important for medicine to have. It's important to have strong research so we can discover new therapies and new approaches, new diagnostic tools, but at the same time, make sure that we teach our students and make sure that they're ready to take on those challenges. That all starts with admissions, right? You're selecting the applicants that will then become students, that will then become clinicians and researchers. So it is all connected under the umbrella of academic medicine.
Yeah. So when you do find some downtime, and you're in the nation's capital, what do you end up doing for fun?
Oh, wow. DC is an amazing place. Why? Because, I'm a big foodie, so we have restaurants and cuisines from all over the world. We have people here in DC from all over the world. So you can have very interesting discussions that, you don't even expect that you will have, and those amazing restaurants, and you can try different cuisines. So we go out and try those new restaurants. A lot of great museums as well.
Sure.
So a lot of cultural activities are happening in DC at all times. So it is a very, very, very nice place to explore. And I think that's what attracts a lot of applicants to our school. It's like, the very good program that we have, but also what DC has to offer.
Yeah, for sure. I think we'll touch on that a little bit more as we get into some curricular related stuff, which is where I want to go to next. And Giannis, when you're meeting with prospective applicants, doing talks or giving presentations, so let's start with, what things do you like them to know about the curriculum at GW? What are those highlights that for you are like, this is something I really want you guys to know or be aware of at our school?
Yeah, no, that's a great question. So, GW offers a very innovative, integrated preclinical curriculum that emphasizes early clinical exposure, that I think it's very important. It also emphasizes problem-based learning and interprofessional education. And with our, healthcare system that changes and has evolved, these are very, very important elements. So our students are engaged in active learning sessions, simulation-based training, and small group discussions, which they really enjoy. And we see that in their feedback. Additionally, for the clinical curriculum now, we provide diverse clinical experiences across the metropolitan DC area, and that allows students to train in urban, community, and tertiary care settings. But we also offer now a regional medical campus that can offer our students some very unique experiences in the Baltimore area. Some special programs that I would like to mention, and I usually also discuss with our applicants, our clinical public health curriculum, which integrates public health principles into the medical training. So it is a longitudinal curriculum. And of course,
for everybody, can I interrupt you? Is that for everybody? Yeah. Okay, so when a med student starts that clinical public health curriculum, everybody's in that. That's not like a special track.
Absolutely. It's not a special track. Everybody
Okay.
can take advantage of the curriculum. What is unique, though, is our scholarly concentration program, and that is not mandatory. So students have the ability to choose to participate in the scholarly concentration program, but they have multiple different areas such as health policy, global health, medical education, clinical and translational research. Actually, I'm co-directing that scholarly concentration. And we've seen a really high number of students selecting that, considering the huge interest in research right now and the anxiety, if you will, of students to distinguish themselves and show what they can do, especially now that step one is pass fail.
Let me ask you a little bit more about that scholarly concentration, because you are a co-director for the clinical translational scholarly concentration. When does a student start that? Is it first year, second year? Is it third year? Let's start there.
First year. So in the first few months, they apply to participate if they want. Again, it's not mandatory, but I would say close to 95% of our students participate in the scholarly concentration program. So it's very popular. And the first few months of their first year, they apply to participate in one of the concentrations, and based, of course, on their interests.
Mm-hmm. And then now that you've been in there and you're the co-director, what does it look like for the student experience? Like, do they pick a lab? Are they picking a clinical area to go into? Like, they can focus in. If I'm always been interested in cardiology, can they do cardiology, or how does that kind of flesh out?
Yeah. Just to be clear, all concentrations can offer some research experience and research exposure. The difference in that the clinical concentration or research concentration has is that it's a little bit more structured. Okay, so this is for people that are focused on research. They want research to be part of their medical studies, and they want to have a project. So that includes lectures, workshops, and in different topics. Again, statistics, for example, or how to design a clinical trial, how to do a literature review, and so forth. But also, they have to select a mentor and work on a project, and they have to create an abstract by the end of the summer of the first year. They participate in that experience with their mentor, and then at the end of that, they have to create an abstract and submit it for our review. And then they participate and they continue participating in research, develop their project, and they can present that at the Student Research Day. And there's also an elective that they can take that is devoted to research and spend time working on their project. So it is a more organized, structured way of doing research, have a mentor, and present your work.
Mm-hmm. Sounds great, and very comprehensive for the student to get involved in that and see things from beginning to end. Can you say a little bit more, Yanis, about the curriculum the first 2 years? You mentioned it sounds like a conglomeration of like small group discussion and some larger group. Is it primarily lecture, or is it small group, like case-based stuff? What's that kind of look like?
Yeah, it is more of a systems-based approach and small group discussions. Of course, there are traditional lectures, but it is, I think, kind of a hybrid that offers them not only a systematic approach to the preclinical curriculum, but also early clinical exposure. They can select a faculty member in any specialty they desire and have sessions with them so they can get an early exposure to clinical medicine, so they can have some context of, a lot of times, and what we saw in the past with a preclinical curriculum that had little or minimal clinical exposure is that students didn't really understand why they were learning all the foundational
Mm-hmm.
or learning more about the foundational sciences. They didn't have that context. So I think by having an early clinical exposure, they get the full picture. So
Mm-hmm.
they understand why they're learning about the heart if they are seeing patients in the clinic with cardiac issues. So
Mm-hmm.
it's easier for them to make the connections and learn.
Oh, cool. Um, well, so being in Washington, D.C., I have to think there's a lot of opportunity for students to get involved in community and community organizations and doing outreach and stuff. Can you talk a little bit about what that looks like for students?
Yeah, so our students definitely participate in community service. We have the Healing Clinic, which is a student-run clinic, student-run organizations and special interest groups, and partnerships with local public health initiatives. And again, don't forget the public health curriculum and the public health summits. And they have service learning experiences to foster social responsibility. So they have the opportunity to work with local organizations, for example, food banks
Mm-hmm.
and other opportunities in the DC area. You know, we have from NGOs to public health organizations. We have a really amazing School of Public Health at GW, and there are a lot of collaborations with the School of Public Health. So being in DC offers them a lot of opportunities to get involved with the community, and it is a very diverse community in DC. Again, as I said, we have people from all over the world, but also it reflects our nation. It is a very, very diverse population.
Yeah, for sure. And lastly, okay, so being in Washington, D.C., do students, if they wanted to get exposure to policy and policy advocacy, being, close to the Capitol and legislators and things like that, do they have an opportunity, maybe if they want to dip their toe into that kind of realm?
Yes, meet with the lawmakers. They're right around the corner from us. So they absolutely do. And in terms of, advocacy and exposure to different cultures, and also thinking about community engagement and social responsibility. They even have the ability, and they do visit the Museum for African American History and the Holocaust Museum that are both located in
Mm-hmm.
DC. And they get exposed and discuss topics that will enable them to have a better understanding of how cultural responsibility and culture in general plays a role in medicine, and approach patients holistically, and how social determinants of health play a role in how patients seek healthcare, and how we can improve access for all.
Yeah. So speaking of students and being exposed to different cultures and the opportunities that they have, what about student support systems within the medical school that help students feel like they belong, or the different support groups or organizations within the unit within the medical school to assist student support?
Yeah, no, that's a great question. And we talk a lot about physician burnout.
Mm-hmm.
This is something that we discuss in mental health. And we know that there is a mental health crisis in this country. So not only do our students get the exposure to what mental health looks like through their electives and their rotations, but we also have specific programs for them, understanding that medical school is very difficult and sometimes can be overwhelming. So we want to make sure that they have the right work-life balance and the opportunities to join, interest groups, participate in wellness programs, and engage in leadership activities. So, we want to make sure that they find time for social activities, for sports, for exploring the DC area. And we do have services, mental health services that are dedicated to students. And of course, our wellness office that organizes many, many activities and has some support systems for our students. So there are many different opportunities for them to be engaged with different activities, but also, get care if they need it.
I think you're referring to the wellness office. I think I stumbled across it when I was doing my homework on your school, that it supports students and faculty and staff at George Washington. And it sounds like like you said, they offer all kinds of different programming and experiences and wellness care for everybody. It's not just for students.
That's absolutely true. So the school a few years ago, they saw what the need was for the community, not just for students, but for faculty and staff. So when this office was created, they had in mind to give a place or create a place for everyone to be engaged and participate in those activities, but also if there is a need for the office to provide the support that's required, to our students, to our faculty members, to our staff members. Mm-hmm. So this has been utilized a lot. It is a really amazing opportunity here at GW. And, there's, as you know, and I don't know, I'm not sure if you saw that, there's a chief wellness officer that runs that office and multiple staff members there that, again, the work that has been done is really amazing.
That sounds like a great initiative. So I'm glad that's in place there. Giannis, before we move on and talk about some of the admissions related things, is there anything else we didn't touch on about your school's curriculum or their structure or opportunities for students that we didn't talk about yet?
Yeah, I would really like to emphasize the support systems a little bit. The curriculum offers, exposure and support for students from diverse backgrounds, those that are underrepresented in medicine, LGBTQ plus, and first generation students. And I would like to also mention that there is academic support as needed, including peer tutoring, faculty mentorship. We have our coaching program where faculty members coach students and counsel students. And again, as we mentioned, we have mental health support, wellness coaching, and a structure remediation program. So if our students need something, we make sure that they get it.
Yeah. That's a question that sometimes comes up for us on interview days. It's like, what happens if I start to struggle academically? And I try to explain to them that there are several safety nets underneath you. It's that a phrase I've used before is it's really hard to get in, but it's really hard to get out. So there's a bunch of safety nets that come into play if somebody starts to struggle academically, that people swoop in. And it sounds like the similar system is in place there at your school too.
Yes, and we're happy we have an office for student support that works with our students to tutor them, to coach them, to counsel them if they struggle. And it's been very successful.
Yeah. Anything else we didn't touch on?
No, I think we did talk about all the different programs that we offer, and again, sometimes I find it difficult for applicants, to look on websites and identify all those different programs that exist in each medical school. So I think these discussions are extremely important, and again, thank you for this initiative. I think it will help a lot of applicants identify specific programs they might like in each of the medical schools they apply to.
Before I move on, one thing I failed to ask you was about you. Right at the beginning, you touched on your clinical affiliates throughout the DC metro area, and you list them on your website, all the different hospital systems that you work with. I have to think that allows an exposure to a very diverse patient population in the DC metro area. Is that a safe assumption?
Oh, absolutely. There are so many different hospitals that they rotate through, from our GW hospital, Children's National, which, as you know, is one of the top pediatric hospitals
Mm-hmm.
in the country, our VA hospital, and psychiatric institutions, and clinics throughout the DC metropolitan area with a very, very diverse population. So our students are exposed to not only to many different cultures and populations, but also different conditions. So they get to see the bread and batter for each specialty, but also the very rare conditions
Mm-hmm.
as well. So they do get a great clinical exposure that will prepare them to work in any community that they choose to.
Yeah, that's fantastic. All right. Well, let's get into the next fun part, which is how do we get in here? Like, what are you looking for? The common questions that arrive on our doorstep. What are you looking for? And we haven't mentioned yet, but you kind of nibbled at it a little bit, that you get a high volume of applications. From what I saw, and for the 23-24 cycle, there was a little over 16,000 applicants. And on a recent call you and I were on, I think you mentioned this year you got 17,000 applications.
Yeah, over 17,000 applications this year, which we're talking about primary applications, right, and close to 14,000 secondary applications.
Right. So a few things that stood out to me and I wanted to ask you about, to go in a little more detail, is that it looks like for prerequisites, you have a competency-based approach for prerequisites. Can you talk a little bit about what that looks like for a prospective applicant? So you don't have, from my understanding, and correct me if I'm wrong, like we require 2 semesters of general chemistry. We require 1 semester of organic chemistry, right? It's something else.
It's competency-based, as you mentioned, and we have recommendations, but not requirements when it comes to courses that they need to have. So we are pretty flexible because, again, we do a holistic review of the application. And I have to say that our process is very transparent. We actually tell applicants what we're looking for on our website, academic excellence, personal attributes and experiences. So it's not a secret sauce per se. We are telling our applicants we want to graduate physician citizens, and while clinical experience is valuable, the admissions committee takes a holistic approach, valuing diverse backgrounds and experiences. For example, research experience is not mandatory. It can enhance an application. We have a lot of applicants with research exposure. But we are looking for applicants with a strong academic background, resilience, leadership, and commitment to service. We are a service-oriented school. We have a public health curriculum, and we are in DC. So we're not hiding the fact that we are looking for service-oriented applicants.
You mentioned leadership, and that, I think, is one of those topics that comes up for prospective applicants. There's a perception that to have it be leadership, it means I need to be designated as the president of a student organization or the vice or on an exec board for a student organization. But there is a finite number of those positions. How do you define leadership in your admissions process? Is it more broadly defined? And if so, what are some examples of what that could look like?
Yeah, I think in a way we're all leaders in our everyday life, and you do not have to be the chair of this organization or establishing a new club or something like that. No. When we talk about leadership, we're talking about those skills. And why are we looking into leadership? Because we want our students, and then when they become providers, to have those leadership skills that are required in order to treat the patients effectively. So we're looking for For example, if someone is running a project, you have a research project, so you're a leader, right? You're the leader of that project. So the fact that you're able to work with others, listen to multiple different opinions. Maybe I disagree with the way you're approaching that project if I'm in the same team. How do you handle those situations? That shows whether you have the required leadership skills. So it's not about the title, it's about the skills.
That's so important. You said that right there at the end. It's not about the title, it's about the skills. So I hope that people that are listening are taking this to heart, that because I'm on board with that. You have said it. I know a number of other admissions people agree with that. And so, but I think it's that leadership one that comes out. And there's a lot of, like I mentioned earlier, angst about that, and people trying to claw their way to get to the exec board of a student organization so they can put leadership on their application.
Yeah, so. Absolutely. There's a lot of anxiety. A lot of times it's also, and without trying to dismiss anyone, but students or applicants look into those blogs and discussions on the internet, and a lot of times there are some false claims on those discussions, and people, because it's a competitive process, the advice that they get there might not be as good. So pre-health advisors, talking to admissions officers, and looking at the websites will give you the best information. And the most accurate information.
Right. So to get into your admissions process a little bit more, and you said it, you're very clear on your website what attributes and characteristics you're looking for. I found it. It's in those you have a whole page of these drop down menus. And because a question I usually ask people that are on my show who are in admissions is like, what are you looking for? What kind of characteristics or attributes are important to you? And you would list them. And like you said, it's not a secret. We don't have a special sauce that we are keeping it a secret. So can you talk a little bit about why you chose those attributes and characteristics?
Yeah, so that goes back to what I said before, that we're trying to select those applicants that will then become physician citizens. We want to have well-rounded physicians. We want to graduate well-rounded physicians that will go out there in the communities and bring change. And what I tell sometimes, when I discuss with those applicants, or even when I meet with them when they visit us, is imagine if each one of those graduates makes a small change in their communities, right? Then it becomes a huge change, because we're talking about a lot of people. So the reason we have all these different qualities and attributes we're looking for is because we want to make sure that when they leave GW and they go and practice in their communities, they can understand the issues that those communities face, and they can tackle those challenges and bring change. And again, you don't have to be the Surgeon General of the United States to bring change. Everybody can bring change in their communities, and as long as they have the skills and can understand what the issues are that face that community.
Yeah. So, and I'm looking at it now, the attributes and the drop down menu on your website, and there's 6 bullet points of things. Is it safe to say, Giannis, that you, as an applicant, you don't have to have all of them and all of them perfectly honed to be a successful applicant or to be accepted to your school? Is that safe to say?
Absolutely. It's not a checklist. So I hope those applicants don't go out there and print it out and check those boxes. We're just indicating some of the examples of those skills, of those attributes that they need to show in their application, and by no means a checklist. And it should not be used like that.
Yeah. A lot of questions we get from prospective students are about medically related experiences. How much is enough for me to put on my application to demonstrate my interest in medicine, my exposure, my understanding of what goes into this. Talk a little bit about when you're analyzing an application, what rises, up to you that you feel like, all right, this person kind of knows what they're getting themselves into and they seem passionate about this professional career.
Yeah. That is an excellent question that a lot of applicants ask. It's not the number of experiences. It's not how many times you've shadowed and how many different specialties. It is the quality of the experience and the exposure. Can you talk about it? What did you learn from it? If you actually shadow a physician for 5 hours, I doubt that you really learned something. It needs to be a sustained experience and exposure so you can actually discuss about it and tell the committee through your application what you got out of that experience to show that this was meaningful. So it's not actually the number of experiences, but, whether that experience gave you something, you understood something about healthcare, and it also solidified your decision to become a physician. Like if that helped you make that decision, it is important to know. So to those that are very anxious out there, I have only 2 experiences. I have this or I have that. It's the quality and and the ability to explain what you learned from it that matters, and not how many of those experiences you've had.
Yeah. So the reflections of what they've taken away from those experiences is the key.
Right. Absolutely.
Yeah. I think that's where sometimes students come up short or applicants have come up short is, yes, they probably have a quote unquote enough hours of like they've been exposed to enough, but where they come up short is in their ability to share or demonstrate in written format of the application what they took away from it, beyond just the facts of like, I saw these procedures, but what they didn't go into was, some of the struggles or how it affected them or what they saw and grew from their observations of being in like behind the curtain, so to speak.
Yeah. And also, observing is one thing, but also hands-on experience is important. Interacting with patients, right? Because ultimately that's going to be your job to talk to patients. And the committee wants to see how you as an applicant have worked with patients, what challenges you've had. A lot of times applicants talk about the challenges they had in those experiences. And one might think, well, are you going to talk about something negative? It's not a negative. It's showing that you thought about what you just experienced and you analyzed it and you learned something from it, which is extremely important. So they should not feel, in any way that an experience, if it's a negative experience or a challenging experience, that it should not be mentioned. Actually, that's something that the committee would like to know. And it shows that you really learned something from it.
An example that comes to mind for me while we're talking about this is I remember reading an application of an applicant who was, she was recruiting patients for a study they were doing. And she led into like how the first patient she went in to interview or to ask if they want to be this study. She's like, I stumbled over my words. I was nervous. And of course, then they said no. But the way she set it up and explained it, she's like, I walked out of there thinking, I'm never going to get anybody to sign up for this research study because of course, I sound terrible when I'm going in there. So she wrote about how she had to kind of become more and like just warm up to people a little bit, how she approached just walking in the room and knocking on the door. The way she wrote it and set it up after that then was it's perfect because it showed her reflections just on how she grew in communication skills and interacting with patients and understanding that maybe they don't want to talk about this right now because they're really scared because they're in the emergency department and they don't know, they're not worried about your study. They're worried about what's going on with them right now. And so she could kind of read the room a little bit better. And so I wanted to add that because do you have any comment on something like that?
No, I that's perfect. I mean, it shows even describing mistakes that you've made. I mean, we
Hmm.
all make mistakes. And that is okay as long as you learn from your mistakes and you don't repeat them. And it also shows, how resilient you are. And in times of adversity, in times of uncertainty, or in times that you're challenged, how you respond to that and how you become better. And one of the things that can help with that is, how you take feedback, right? How do you
Hmm.
approach that? And if you accept constructive feedback, and how that helps you overcome issues or mistakes that you've made. So these are important things that the applicants need to emphasize in their applications, and they should not be afraid to mention those things.
Hmm. I think maybe prospective students don't realize how much feedback you're going to receive as a medical student and a physician in training, right? And that resilience comes up all the time, and that is that ability to take feedback, and which then sometimes is unexpected feedback, or it hurts a little bit, but you got to show up the next day and look people in the face and say, I made a mistake yesterday, I'm doing better today. I'm like, so that takes resilience, but you're going to get a lot of feedback as a physician in training. Can you say more
Oh,
about that?
it never stops. I can tell you, after many years practicing, that never stops. And actually, that's the only way to improve, to get better. And I'm really glad that, our hospitals, including here at GW, there are mechanisms to report mistakes,
Hmm.
without, being afraid of retribution or anything like that, to be able to report things, to get better, to improve processes, right? Without that, we're not going to be better. And the issue is not about me or you or anybody else. It's about the patients.
Hmm.
So we need to have that type of mentality of, being able to accept feedback,
Hmm.
and get better because of that feedback. I strongly believe that that's a great quality of someone to have, especially when they want to become physicians.
Yeah. Yeah. Um, Little mechanics here. I noticed on your website when it comes to the MCAT, you list that there's a minimum score that for people that for the subsections that you look for, which I think is 125. It's not a requirement, but it's just kind of a heads up. We kind of look for 125 and above in the sub score sections, but you super score the MCAT, which I don't see very often. Can you talk a little bit about your super score process?
Yes. So we don't have an MCAT cutoff. We don't have cutoff in the sub scores. We're just letting the applicants know, because I think it's fair that specific scores and a specific score and below is not considered competitive. That being said, you can still apply, but with the understanding that you're not a competitive applicant. So
Hmm.
we want to be as transparent as possible. We don't want to, tell them, we don't have any cutoffs and every score is considered the same, because that's not the truth. With that said, we are using a super score. That means if you've taken the MCAT 2 or 3 times, we will take the highest sub score from each one of those attempts to calculate a total score. And in a lot of cases, your total score using a super score will be higher than
Hmm.
those attempts. That we do that to help the students, because again, we understand that not every day is the same. So that means you might have not a great day, the day that you take the MCAT, but still, if you scored high in one of those sub scores, we want to take it into account.
Is there okay? So you take a sub score of multiple MCATs, because people, if they've been listening to this, I don't think there's any shame in retaking the MCAT. It's not the first choice, but it does happen sometimes. But is there a number of maybe a little itchy twitchy if you're seeing, 5 MCAT attempts or 6 MCAT attempts, even they're trying to super score this thing up?
So we do not have a cutoff, but it would be a lie to say that it doesn't matter if you took the MCAT 5 times. So the committee will look into that. Again, there's no cutoff to say if you took the MCAT 3 times, you're out. But they will look into that and see also if there has been an improvement in the scores. If someone gets a 512 and then they retake it and they get a 500, and then they retake it and they get a 485, then the committee will take that into account as well. So it's the number of times, but also whether there is an improvement in the score.
Mm-hmm. So you see all the scores, and then there's a super score at the end or the top. Let's talk a little bit about preview. I noticed on here that on your website that you say for the 2025 cycle, which is the time we're having this conversation, that preview is recommended. If you have the score, submit it. We'll see it. But if you don't have it, it's not perceived as a negative. Is that a correct assumption?
With the addition that even if you don't do well, it's still not going to be used against you. So it is only a plus factor. It is, we're using it only if you have a high score. And by the way, for people, most people don't know that the average preview score is 5. So we're used in medical school with, the highest number. So, the range is from 1 to 9. When we say that someone has a good preview score, we don't mean an 8 and a 9. Okay. The average is 5. But if someone has below average, for example, or if they have not taken the preview, it's like, we treat it the same way. We don't take it into account. If you have a high preview score, it's another factor. It's like someone has research, someone doesn't. Mm-hmm. Someone has more clinical experiences, someone has fewer experiences. It's a holistic approach. So it is another data point in your application, but only as a positive factor and not as a negative.
Yep. So it's a plus factor if you have it.
Yes. And it's not used in the decision about interviews. It's only used by the committee in the final decision. So we're not screening people out based on their previous scores. It is a good thing to have because, it is another way to measure or to show your non-academic performance, but we're not using it against any applicant or screening out applicants.
Mm-hmm. And now so many schools are recommending it or requiring it that as an applicant, you're probably going to wind up taking it for somebody, depending on where you're applying.
Yeah,
so
absolutely. And I think we've seen a huge increase in the number of people that have taken the preview. The majority of our applicants now have a preview score, which I think is great.
And do you has the school come up with like a long-term plan? Are you using it for kind of a long-term study to look for any correlations within the curriculum and then beyond?
Yeah, so we are looking at our data and see how to best utilize the preview. More to come on that. And most schools are doing the same thing. Because the reason we're not using it against anyone or we're not screening out applicants is we don't have enough data to use it in such a way. So we are very careful. We don't want to disadvantage our applicants. We want to make sure that everybody gets a fair, has a fair shot at getting in. So we are trying to be and we're trying to be as transparent as possible. So yes, there are discussions. Nothing has been finalized. So more to come on that in the future.
Well, that's the thing with these correlation studies with something like this. It takes years to get the classes then to go through, their curriculum. And so it takes years to start to collect data and look for trends on these kind of things.
Absolutely. It takes years. And again, because this is a high stakes process, you don't want to make mistakes because if you do, you're disadvantaging applicants. And this is definitely not something we want to do.
Yeah. All right. How do you guys get through all these applications?
That is a very good question. And when we review all our applications, you know, we have the committee is so well trained that they're very good at reviewing applications fast and efficiently. And, now we are getting at a point that it becomes extremely challenging because of the number of applications. And if it keeps going up, then I think we're going to be overwhelmed. And as you already know, we have looked into potential solutions. Mm-hmm. For example, in the use of AI, artificial mm-hmm. intelligence, in the application review process. And as we've discussed before, and I'm member of the technical advisory committee on the use of AI in medical school admissions that was established by the AAMC. And we are looking into ways to integrate AI in the medical school admissions process. Now, I want to make it very clear, we're far from that. We have not finalized anything and we're not using it right now. And also, the idea is to be more efficient. It is mm-hmm. not to replace human review and have a machine decide who gets an interview and who doesn't, or who gets into med school or who doesn't. That is a decision made by the Committee on Admissions that has the sole responsibility in the school to make those decisions. So I just want to make it very clear that is not the goal. It is just we're trying to make our systems more efficient because of the very high number of applications that we receive. And that's not mm-hmm. at GW only, but at other medical schools as well. I know you guys are overwhelmed as well. It is a trend that we've seen in the past couple of years. And if that continues, we need to find ways to be more efficient. We also don't want the applicants to wait for decisions forever, mm-hmm. Because I understand. I've been there. It is a very stressful situation, and we want to make sure that we make decisions in a timely manner. And we're looking into many other ways to do that. I just mentioned one of the possible solutions to this problem is the use of AI. But again, this is also still under discussion, and no decisions have been made, and more to come on that.
Yeah, I agree, and you're right. This is a pretty popular topic in our field right now, and because we're all drowning in applications, we have to find maybe some potential solutions to help increase the efficiency of what we're doing. And with these emerging technologies, it won't take away the human touch. But how can it help us kind of be more efficient with getting to that human touch to benefit applicants, whether it's even also kind of creating more of a standardization of review of some kind, because some schools have 50 screeners or 100 screeners. And how can you have there could be some variability in human evaluation of applications. So could there be some more standardization? But it's an emerging technology, and this is a conversation that's taking place nationally. So more to come on that. But it's fascinating, though. It's fascinating.
It is, and as I say, yes, AI can have, there's always the risk for bias, but also humans have a lot of biases as well. Yes. So it's not a perfect process to begin with. What we're trying to do is find ways to improve that and mitigate bias as much as we can. Again, by no means are we trying to make this or disadvantage anyone or make it such that the machine is going to be making decisions without human oversight.
Yep, for sure. Just to kind of wind things down here a little bit, Giannis, is there any part of your process that you see applicants sometimes get tripped up on, that you wish that they would have done something or looked more closely at a part of your process that you see sometimes people get tripped up on?
Yeah, so I wanted to mention a little bit about the interview. Because I've seen, issues there. First of all, our faculty members that are interviewing have no access to the applicant's file.
Okay.
So, we do that so they have no clue about their MCAT, they have no clue about their GPA, they have no clue about anything that they've done. So it can be a natural discussion and not a focus on what they've already done that we can actually see. We can actually see that. The committee can see those things. There's no need for the interviewer to discuss any of that. So a lot of times I think applicants are either underprepared or overprepared. And that, being overprepared can be a problem as well. Because our interviewers, and I'm sure yours and in other schools, are very well trained to understand whether that applicant is a good fit for the school. So if someone, for example, is reading off of a screen, or they have rehearsed every possible response, they come off as not genuine. And that is a problem. So I would advise them to be as natural as possible. They need to show why they want to be physicians and why they want to be in a certain medical school. And by over preparing, sometimes it doesn't look very genuine, and that creates problems. Under preparing is also an issue, right? I hope that at least they look on the websites and they can identify a few things that they like in each medical school, and they haven't applied just because.
Yeah.
So I think the interview sometimes, and again, I know there are MMIs and other types of interviews out there, but I would encourage the applicants to, one, research the schools a little bit and see what they offer, and also not over prepare. They need to be themselves and explain why they want to be at a medical school or why they want to be physicians, which I know sound easy questions, but a lot of times people seem confused. So I would encourage them to do those things.
Yeah. So your interviews are going to stay on Zoom or virtual?
Yeah. Yeah. For the foreseeable future, we're not going back to in-person interviews.
So, I would just say I was nodding emphatically when you were saying, like, please don't read off a screen. By all means, please resist that temptation to do that, because we can see your eyes moving back and forth. And sometimes people who wear glasses, we can see the reflection on your glasses of the other screen. And it just comes across like you're reading and not an authentic, just genuine response. That you may have, it's okay to practice responses, kind of like how you might want them to kind of sound a little bit, but it's been happening every year since we've started doing this on Zoom, and there's just some temptation to want to have that crutch beside you and to want to read a response. And when we used to do this in person, these interviews in person in the good old pre-COVID days, you would never even have that opportunity because you'd be sitting across a desk from somebody. So, I just can't implore students enough. Resist that temptation not to do that. It's going to sink you.
Yeah. And also, because these are Zoom interviews, be professional. It doesn't matter whether it's an online interview or an in-person interview. Professionalism is important. And I'm not talking about the way people dress. I can understand not everybody has access or might have access to specific types of clothes. But, the important part is be professional, respectful, and also, that faculty member they volunteer their time to learn about those applicants. So they should, respect the process and be as professional as possible.
Yeah, these are high stakes conversations. So,
absolutely, considering the number of applications.
That's right. So when you get the interview invitation, this is a big hurdle that you've overcome. And now you're this much closer to getting into med school. And my fingers are really close together right now. But you're really close to getting to reach your goal. And so don't blow it by using a crutch like a second screen with stuff on there to read, or don't take it kind of seriously or serious enough. But still, you got to try to be authentic in who you are when you're having these conversations with your interviewers. It's a little bit of an art. I mean, it takes some practice. I mean, there's no doubt about it, to kind of become comfortable in that situation. But that's the importance of it. So, Giannis, before I let you go, anything else about your admissions process that we didn't touch on that you felt like you wanted to be able to share with listeners today?
Again, my advice to everyone is, for their application and for the interview, if they're invited to interview with us, the important thing is to showcase their unique attributes and passion for medicine in all aspects. Again, whether that's the written application, the primary application, the secondary application, which is extremely important as well, or their interview. Those attributes, I mean, the academic excellence is very obvious, it's right there, but those experiences, those attributes, they need to highlight. They need to sell themselves, right? That they have all it takes to become successful physicians and physician citizens, as we mentioned before. So that's the time to highlight all the things that they've done and not be shy about them.
Yeah, you need to become comfortable in tooting your own horn a little bit, but with some humility, of course. But
absolutely,
yeah. But this is the time for you to kind of share. The stage is yours. The floor is yours. Somebody's giving you a microphone to talk about who you are and what your passions are, as far in your interests in school, the school you're interviewing at. So, yeah, that's a big deal. It's a big deal. Well, Giannis, I've been asking all the questions today, and you've given me tremendous responses, and I think people listening are going to find this really insightful and helpful. What questions would you like to ask me?
I don't think I have any questions right now. Again, I will invite you to come to DC and see our campus, and also explore some of the restaurants and cultural activities that DC has to offer. So you're invited, and you're welcome at any time.
I appreciate it. I have an open invitation to a personal tour guide, perhaps, of some of the most eclectic restaurants in the country, because I'll eat just about anything. I'll try just about anything. So I'm game.
All right, let's do it.
Yeah. Well, thank you so much, Giannis. It's great to have you. I appreciate it.
Thank you.